Masaka Regional Referral Hospital is treating a man who says he is part of a group of 7 suspected Ebola cases who escaped from the Ebola isolation unit in Mubende Regional Referral Hospital a few days after admission on 20th September 2022.
He came in and collapsed at emergency. Then he was resuscitated and he woke up. Right now he's talking and he's able to communicate. Yes, the patient came in with all the signs and symptoms of Ebola. He came in with bleeding from the nose, bleeding from the mouth, the ears, and then the anal orifice.
According to the Masaka hospital in charge, this particular patient was with 2 others who escaped.
They escaped 3 of them from Mubende about 4 days ago. They were in the isolation unit. That's where they escaped from. When they escaped, they used the routes. These routes which are crosses direct from where? From Mubende to Masaka. So they report that one person has crossed to Tanzania, one of the friends has crossed to Tanzania, the person they escaped with. Then one stopped at Bunga.
Following their escape, Mubende RDC Rosemary Byabasheja said a manhunt was on to find the 7 escapees.
We know her whereabouts. We are yet to reach her. We are still investigating. We are yet to reach her. But I'm appealing to her to come back to the hospital.
Dr. Okello says Masaka Regional Referral Hospital has since put up an isolation unit with some suspected cases.
We have had about 5 suspects of Ebola hemorrhagic fever, of which 3 samples so far turned negative. The 2, we are still waiting for the results. 1 we have just got today, of which we have picked samples and they have taken to UVRI for testing.
Meanwhile, the Ministry of Health is awaiting the results of a suspected Ebola death that occurred at Kasangati Health Center 4 in Wakiso District on Monday. Dr. Peter Sejibwa, who works at the facility, says the deceased reported with visible signs of Ebola.
The patient was around 20 years of age from Namlonge village and had symptoms of headache, of vomiting blood, had diarrhea and was bleeding profusely. And around 5 in the evening, the patient passed on. So we cordoned off the place, like you see the ward, and the caretakers were also kept around, awaiting isolation.
However, through her Twitter handle, Health Minister Dr. Jane Ruth Acheng says there is still no confirmed case of the hemorrhagic fever in Kampala. President Yoweri Museveni is scheduled to address the country on matters concerning Ebola outbreak on Wednesday evening at 8 p.m. Walter Mwesije, NTV.